Hello and welcome to the Survive and Thrive series hosted by the Taussig Cancer Institute. My name is Alex Murray, and I am here today to talk to you about the topic of self-image after cancer. I want to thank the coordinators and Dr. Melissa Walt, especially for inviting me to give this presentation today. As I mentioned, my name is Alex Murray. I'm a clinical psychologist at the Cleveland Clinic. I specialize in working specifically with breast cancer patients and survivors. Myself and my colleagues in the breast center work with patients across the care continuum, including those who are at high genetic risk for breast cancer, those diagnosed, metastatic patients, and those in survivorship. Today, we'll be exploring the topic of self-image and how the experience of being diagnosed and treated for cancer can subtly and even radically change how we see ourselves, how we relate to others in our relationships, in our communities, and how compassionate we may be in offering the care we deserve to ourselves after cancer treatment is over. I have no financial disclosures or conflicts of interest to report. This may be a little different with a recorded presentation, but generally within virtual meetings, just to be thoughtful about confidentiality of others on virtual calls and respectful of people's time and the presentation itself. Today, what we'll cover, we'll start by naming some real impacts of cancer treatment on how we see ourselves, not just physically, but also emotionally, socially, and even spiritually. I'll introduce a few tools from the modalities that I practice within psychotherapy, within mindfulness-based practice, and some other tools from the work of others on self-compassion. And we'll talk very briefly about these very big topics of grief during and after cancer treatment, post-traumatic growth, as well as authentically living in the present in survivorship. Survivorship from cancer also often means living in a body that feels unfamiliar or changed. Some changes are visible, others are invisible, deeply internal. Many people I work with share feeling as though they have this sense of betrayal from their bodies. They have anxiety or disconnection from their bodies and who they used to be in the spaces that they occupied before cancer treatment. All of these experiences are valid, they deserve space, and these processes are often long-term in nature. There can be immediate and long-term confrontation with physical changes, identity disruption in terms of who am I now, right? Who am I at work? Who am I in my family, in my communities? Who am I if I can't fill in the blank, right? There's disruption and adjustment across many spheres of life. And as we mentioned, some of these changes are invisible, right? Many may not recognize how much a cancer survivor is going through, right in front of them, in terms of the grief for what's been lost, the disconnection from their body or adjustment to a new normal, right? Changes to one's sexuality, confidence, one's self-worth, and even their gender identity. Right? How much of a woman or a man am I after a treatment? And again, some of these processes are immediate and some are long-term. So what even is self-image? And so self-image is more than how we look. It is how we feel about who we are. It's how we feel in our bodies, what our bodies can do, how they function. It includes our sense of attractiveness, our sense of capability, our self-worth, and our identity across a variety of factors. And it's important to recognize that much of what we believe about ourselves has been influenced, or at least influenced, if not programmed, culturally, often without our consent. Right? So we are taught from a very young age what bodies should look like, what strength looks like, what femininity or masculinity looks like and feels like. These messages are filtered through a whole variety of other systems, excuse me, in society, including systems of race and gender, age and ability. These cultural systems and narratives really shape our self-image in ways that can be both subtle and powerful. And after cancer, many people feel as though they don't fit the mold that they used to. Many people feel that their identity is shaken, potentially willingly, when they start to realign values or clarify what's important to them, but oftentimes unwillingly, based on others' expectations and others' assumptions. And it can mean that in cancer survivorship, it might be a time where people are often re-clarifying and reprioritizing their values and their principles. So this can create an opportunity. It's again, as we mentioned, there might be grief involved or other emotional difficulties. There might also be an opportunity to question some of those cultural stories, some of the stories we've heard in our own families or in our communities, and begin to rewrite our own. Self-image is an internalized sense of how we appear, who we are. Again, sometimes these internalizations happen, they're from, longer than we can remember. And as we are questioning whether or not these ideals or these stories still fit, right, that adjustment can be difficult. It can be a process, and it can be eye-opening. Our culture doesn't leave a ton of room for real lived-in bodies, right? Let alone those touched by cancer. There's a lot of sociocultural pressures in terms of how we continue to occupy the spaces that we used to occupy. And if we zoom out for a minute from each individual experience and consider the sociocultural pressures at play here, there are many, many myths, through many systems of work and within families, within communities, within workplaces about productivity, right? What did you do today? What do you do for work? What did you accomplish today, right? That is our sense of worth in society. Many cancer survivors have to reckon with what the expectations they had for themselves or that others had about what it means to be back to normal. What does it mean to question some of these pressures about beauty ideals, right? Trying to fit a mold, again, that may not fit in a body that now has experienced cancer treatment. And again, to zoom out a little further and see some of these systems of ableism, ageism, racism, as they exist within and outside of medical spaces. And to start to become more aware of the context and sometimes the layered intersectional context that people who have been treated for cancer are dealing with when it comes to the systemic pressures to get back to normal or to reintegrate into their lives. And a lot of times what happens is that our mind starts to tell us these stories, right? Our mind is incredibly good at creating narratives, at telling stories. The type of psychotherapy that I practice most is acceptance and commitment therapy. And this type of therapy has been shown to be effective in reducing fear of cancer recurrence and symptoms of anxiety and depression for cancer survivors, as well as many other groups. Within ACT, one of the things that I find most important is to really be thoughtful about the language that we use, right? The language that our mind uses when it starts to tell these stories, right? And if we start to detach from our thoughts, and become that mindful observer, which are some of the skills that we can learn through psychotherapy as well as other mindfulness-based practices, we can start to notice that story. We can start to notice potentially how critical our mind is of how we have come through cancer treatment, of where we are now. Right? And if we can zoom out even further from that story and hold it tightly with compassion, right? Can we approach it with a compassionate lens about just how painful this story might be to hear, right? And then as we move further into this practice, can we explore what is it that I want to be focused on instead, right? What is it that I want to really dedicate my energy to, right? And reconnect to my core values, to my core principles, to become more aware of how much energy, right, where my energy is going. So noticing that story, noticing how painful it can be to be the observer, to be the one who hears these stories of I'm no longer attractive or I'm broken. And rather than arguing with that thought or trying to ignore it completely, we name it, right? I'm having this thought, and it's a really painful thought to have. And when we ask ourselves those questions, and we start to recognize these thoughts as how painful they are and how unhelpful they are at allowing us to live our lives the way that we want to live them. So this is one type of intervention that we can utilize in psychotherapy, in order to ask ourselves, how do we want to live? What do we want to connect to? Right? What do my core values dictate about how I respond to suffering, to struggle? Right? And we'll talk a little bit in a few slides about what it might be like to respond to ourselves in the same kind of way we would respond to a friend. I mentioned mindfulness-based practice a bit already, but this is one type of intervention that has been shown to be helpful and that we can utilize in terms of, again, kind of grounding ourselves in this present moment, coming into the now, right? Allowing you to meet yourself in this moment. And the definition of mindfulness that I use most often is that from Jon Kabat-Zinn, displayed for you here, which is that mindfulness means paying attention on purpose in the moment, non-judgmentally, attending to our conscious awareness and to how our body feels with curiosity rather than judgment, allowing ourselves to scan for what is it that your body needs? What is it that we can offer your mind, your body, your spirit in this moment? Certain mindfulness-based practices that can be helpful in this area include that of, so there's body scan meditations, perhaps mindful movement, different types of breath work, including diaphragmatic breathing. And as an option, I always want to throw out that we do have the option to be mindful and mindfully joyful in movement, right? We often hear in the cancer survivorship sphere about movement in the context of exercise, and there can be a lot of pressure for cancer survivors in this way to manage get a certain amount of exercise, a certain type of exercise every week. And I always like to make sure to plug joy in movement. So one way that we can, again, kind of come into this moment, ground our awareness in the present moment, reconnect with what is it that's really important and meaningful for us now. So mindfulness practice is one thing that we can incorporate in this way. And I would be remiss not to introduce the work of Dr. Kristen Neff. For those who are unaware, she is the most prolific researcher in the topic of self-compassion. Self-compassion shifts how we relate to ourselves, including our histories, including the pain we've experienced. And when your self-image feels threatened or potentially even shattered during and after cancer treatment, it's possible you might hear a more critical voice, right? A voice that perhaps illustrates what has been lost, potentially focuses on failure rather than growth. And the question is, what if you responded to this voice as you would to a dear friend? Okay? What might it be like instead of hearing that criticism to hear, this is hard. You didn't choose this. You're still you. Okay? That shift can be radical. Okay? So self-compassion asks us through a series of different components of mindful awareness, of treating oneself with self-kindness, and common humanity versus isolation. So acknowledging that we're not alone, right? Connection and community. And tuning in to that inner caregiver, that inner friend, right? Rather than that inner critic. In addition to both mindfulness-based practice and other things that we've talked about already, I think it's important to acknowledge that for many cancer survivors, they have confronted existential anxiety. Right? And within existential psychotherapy, we ask not just what has been lost, right, but also what is emerging. So within existential psychotherapy, we might focus more on what does it mean to create meaning, right, out of your life? Right? What is it that we might explore in terms of your identity, just adjustments, right? What else is it that makes you who you are? What else makes you who you are besides the illness experience? And now on this side, how do we want to continue to clarify what is really important? How do we want to create meaning out of your life? You get to be the author here, right? So briefly, some exercises for reflection, whether you might choose to journal or meditate on this question and see what arises for you, or simply pause and notice the thoughts and feelings that come up um, to the question of what would it look like to treat my body as an ally instead of an enemy, even just for today, even just for a moment. Right? What might it be like to ask our body what it needs? Do you need a rest? Do you need a walk? Do you need a hug? Do you need a snack? Right? Um, and and again, to reflect in a mindful way might mean for you to breathe and notice those thoughts, or potentially journal, or through connection and conversation with another person who knows you well, or another survivor. So considering, what it might be like to reflect on these questions now, or potentially to jot them down and consider reflection in the future. Coming to conclusion here, just to hit some of the high points, right? You are not a diagnosis. You are not a treatment history. You are not, uh, your worth was never in your appearance or the roles that you played in your life. But all of that might be different now, or some of it might be subtly different now. Um, and many others may try to define you by some of those terms. But your identity is yours to claim. And you get to decide what matters now. You get to decide what's meaningful now. You get to decide what's no longer meaningful if the answers have changed. Couple resources just to make sure that everybody is aware. I mentioned the work of Dr. Kristen Neff. There are tons of resources on her website, self-compassion.org. She has videos of herself personally describing some of these concepts and some of what she's found through her research, as well as audio guided practices that are available for free, and journal prompts and other exercises. Here at the Cleveland Clinic, we have a couple different options. So there are certainly the psychologists and psychiatrists that and social work team through Taussig Behavioral Health. Myself and Dr. Kim Oni right now are the psychologists in the breast center. So we see people virtually and in person across the region. Again, those affected by breast cancer, or those in breast cancer survivorship. And then certainly for general psychotherapy, we have the Cleveland Clinic Adult Behavioral Health Program. The Gathering Place, for those who are unaware, is an incredible organization. They have a variety of programs for cancer survivors that are updated every couple of months. So certainly a wonderful organization. Their website is touchedbycancer.org, and I could not recommend them enough. In closing, again, thank you for the invitation to be here. I want to finish with this quote that I think is just so powerful, to acknowledge that the body is not an apology, right? It is not something to be forgiven. It is something to be lived in, celebrated, loved. And so I hope that this presentation was helpful in order to think a bit more deeply about the concept of self-image after cancer, about some of the ways that we might be able to process how we got here and where we'd like to go. And I hope that some of these selected references and resources might be of value to you. And please, if I can be of any support, I can be found at the Breast Center and through the Taussig Cancer Institute. So thank you again for your time, and I appreciate everybody's attention today. Thank you.